Acne. Acne is a common skin condition that affects most people at some point. It causes spots, oily skin, and sometimes skin that's hot or painful to touch. Symptoms of acne. Acne most commonly developed on the face, back, and chest. In face, almost everyone will be having acne, and in the back, around half number of people with acne will be having on back, and on chest around 50% people with acne will have this. And there are mainly 6 types of spots. They are blackhead, whitehead, papules, pustules, nodule, and cyst. In blackheads, there will be small black or yellowish bump that develop on the skin. They are not filled with dirt but are black because of inner lining of the hair follicles produce the color. And whitehead has a similar appearance to blackhead but may firmly and will not empty when squeezed. In papules, they are small red bumps that may feel tender or sore. Pustules, they are similar to papules but have a white tip in the center, and this is caused by buildup of pus. That's why it's called pustules. In nodules, large hard lump that builds up beneath the surface of the skin and can be painful. And the last one is cyst, the most severe type of spot caused by acne. They are large pus-filled lumps that look similar to boils and carry the greatest risk of causing permanent scarring. So, what are the things you can try if you have acne? These are some self-limiting techniques which may be useful. The first one is do not wash affected area of skin more than twice a day. Frequent washing can irritate the skin and make symptoms worse. Second, wash the affected area with a mild soap or cleanser and lukewarm water. Very hot or cold water can make acne worse. Third one, do not try to clean out blackheads or squeeze spots. This can make them worse and cause permanent scarring. Fourth one, avoid using too much of makeups and cosmetics. Use water-based products that are described as non-comedogenic. This means product is less likely to block the pore in your skin. Fifth one, completely removable makeup before going to bed. The next one is, if dry skin is a problem, use a fragrance-free water-based emollient. Regular exercise can improve your acne, but it can boost your mood and improve your self-esteem. Shower as soon as possible once you finish exercising, as sweat can irritate your acne. Though regular exercise cannot improve your acne, it can boost your mood and improve your self-esteem. And the last one, wash your hair regularly and try to avoid letting your hair fall across your face. Although acne cannot be cured, but it can be controlled with treatment. If you develop mild acne, it is good idea to speak to the pharmacist for advice. Several creams, lotions, and gels for treating spots are available to buy from pharmacies. Products containing a low concentration of benzoyl peroxidase may be recommended, but be careful as this can bleach clothing. If your acne is severe or appears on chest, back, it may need to be treated with antibiotics or strong creams that are only available on prescription. When to seek medical advice. If you have a mild acne, speak to pharmacist about medicine to treat it. If these do not control your acne or it is making you feel very unhappy, you can see GP. You should see GP if you have moderate or severe acne or you develop nodules or cyst, as they need to be treated properly to avoid scarring. Try to resist the temptation to pick or squeeze the spot, as this can lead to permanent scarring. Treatment can be taken up to 3 months to work, so do not expect the result overnight. Once they do start to work, the result will usually be good. Why do I have acne? Acne is most commonly linked to the change in hormone level during puberty, but it can start at any age. Certain hormones cause the grease producing glands next to hair follicles in the skin to produce large amount of oil, that is abnormal sebum. This abnormal sebum changes the activity of usually harmless skin bacterium called P. acnes, which becomes more aggressive and causes inflammation and pus. The hormone also thicken the lining of the hair follicles, causing blockage of pores. Cleaning the skin does not help to remove this blockage. Other possible can be due to some familial reason. If both mother and father had acne, it is likely that you will also have acne. And hormonal changes such as those that occurs during the menstrual cycle or pregnancy can also lead to episode of acne in women. There is no evidence that diet, poor hygiene, sexual activity play a role in acne. Who are affected? Acne is common in teenagers, young adults. About 90% people aged 11 to 30 are affected by acne to some extent. Acne is most common in girls from the age of 14 to 17 and in boys from the age of 16 to 19. Most people have acne on and off for several years before their symptoms start to improve as they get older. Acne often disappears when a person is in their mid-20s. So, let's talk about the other thing. Acne is caused when tiny holes in the skin known as hair follicles becomes blocked. Sebaceous glands are tiny glands found near the surface of your skin. The glands are attached to hair follicles, which are a small hole in your skin that an individual hair grows out of. Sebaceous glands lubricate the hair and the skin to stop it drying out. They do this by producing an oily substance called sebum. In acne, the glands begins to produce too much of sebum. The excess sebum mixes with dead skin cells and both substances form a plug in the follicles. If the plugged follicle is close to the surface of the skin, it bulges out, creating a whitehead. Alternately, Alternatively, the plugged follicles can be opened to the skin, creating blackheads. Normally harmless bacteria that lives on the skin can then contaminate and infect the plugged follicles, causing papules, pustules, nodules, and cyst. In testosterone also, teenage acne is thought to be triggered by increased level of hormones called testosterone, which occurs during puberty. And in families also, in women's, like in there are times like in period it can flare up just before their period. In pregnant women's during the first 3 months of pregnancy. Polycystic ovary syndrome, a common condition that occurs acne, weight gain, and the formation of small cysts inside the ovary. Other triggers like some cosmetic products, certain medications like steroid, lithium, which is used to treat depression and bipolar disease, and some other drugs used to treat epilepsy can flare up. Regular wearing items that place pressure on the affected area skin, such as headband or backpack. Smoking can also contribute to acne in some older people. There is a myth of acne. Some of them are: acne is caused by poor diet. It is not related with diet, but eating healthy balanced diet is recommended because it is good for your heart and health in general.